Hi, my name is Sam Phinney. I'm a general surgeon here at Highlands Ranch Hospital. I work for CU Medicine General Surgery. It took me a long time. I thought about being a doctor when I was a wilderness EMT right after high school. I thought it was interesting, but really couldn't conceive of the work that was required. I did pre-med track in undergrad and frankly got destroyed by chemistry. So I had to take a year off. I worked on an ambulance crew. I worked in Costa Rica. I did home visits. I did vaccinations. I worked on an ambulance crew down there. Briefly became fluent in Spanish, and then came back and was ready to take on organic chemistry, and then I was sure. As a general surgeon, we help with patients who are having a bad day and come to the emergency department either for trauma or they have an acute care surgery problem such as appendicitis, an inflamed gallbladder, perfed diverticulitis, or a problem with their colon where it becomes leaky and they have a lot of abdominal pain. Acutely, yes, you can't breathe, you're bleeding on the floor, you just had a car accident, I'm your guy. And then there's a whole different setting. We also see patients in our clinic to discuss elective problems. So, doctor, I have a problem. My groin bulges, my abdominal cavity hurts. I've got this mass, I've got a mole. I can meet you in clinic in your own clothes. We can discuss, name the problem, make a treatment plan, and then we can, if surgery is relevant, make a plan to take you to the operating room, fix it, and then we see you in the post-operative setting until we're satisfied that the problem is resolved. You got to look at the whole patient. You may be coming in with a defined problem of I have an inguinal hernia or I've got symptomatic gallstones, but I think a far more comprehensive approach leads to better outcomes and happier patients. So I'd rather meet you in person and understand who you are, what's important to you, what do you do for a living. If you're retired and you're going to ski 1,000,000 vertical feet up at Vail every year, that's a whole different demographic than can't get out of the wheelchair. And these are all my people. They may need similar operations, but there's going to be differences. When I was deciding to be a doctor, what I actually found that I valued the most was the elective relationship with patients. This is basically established by meeting somebody before surgery, ideally in the clinic, seeing them before, taking good care of them during the case, and then following them afterwards. Now, for the majority of my patients, that's basically 3 to 4 interactions. If we're trying to optimize you, I may see you every 1 or 2 months to make sure that we're heading in the right direction. Afterwards, if there's been a complicated course or it's just a very difficult situation, I've followed patients for up to 2 or 3 years. I don't wish for any of my patients to have that experience, but sometimes that's what we get. And that's what we have to do to make sure that we have taken care of these patients. The good experience that we want you to have is an aggregate effort, not only from myself, but all of my team, everyone in the PACU, the pre-op area, and the OR, to make sure that this feels right, it feels comfortable, it feels like you're in good hands, and that you're going to be fine.